Welcome to our Gynaecology series. This video is on uterus positions. Uterus positions are visualized using pelvic ultrasound. They are variable physiologic positions. These are combinations of ante and retroversion, levo or dextroversion, and ante or retroflexion. An anteverted uterus is when the cervical canal forms an angle of 90 degrees or smaller with the vaginal canal. A retroverted uterus is the opposite and more common in multiparous females. A levoverted uterus is tilted to the left compared to the midline, and a dextroverted uterus is tilted to the right compared to the midline. Then there is the ante and retroflexion. An anteflexed uterus exists when the body and the fundus of the uterus are curved forward on the cervix. An average uterine position is anteverted and anteflexed. It is held in position by round ligaments in nulliparous females and tipped backwards by a full bladder. Here you can see a simplified image showing the female hip. You can see the vaginal canal from the midpoint to the right part of the circle and how the cervical canal is located with an angle of less or equal to 90 degrees in anteflexion compared to the vaginal canal, and how the cervical canal is located at an angle of greater than 90 degrees to the vaginal canal in retroversion. On the right part, the two images to the right show the anteflexion and retroflexion of the cervical canal. These images, in a very simplified form, show the female pelvis when it is cut longitudinally and at the midline. You can see the way the pink cervical canal lies compared to the vaginal canal. On the two right images, you can see the curvature of the cervical canal backward and forward. Please note that the anteflexed uterus in this case is also in anteversion, while I chose a retroverse position for the retroflexed uterus. Naturally, other combinations are also possible. Lastly, I would like to mention the uterine prolapse, which is an abnormal dropping of the uterus into the vagina, that is, caudally. It occurs when the uterine ligaments and pelvic floor muscles are weak. This video was part of our gynecology series, and it was on uterus positions.